Hi, I'm Jeff Todd, President and CEO at Prevent Blindness. Welcome to the Focus on Eye Health Expert Series. Today, we're going to be talking with Dr. Paul Chan, head of the Department of Ophthalmology and Visual Sciences and the John H. Panton Professor of Ophthalmology at University of Illinois College of Medicine, and director of the Pediatric Retina and Retinopathy of Prematurity Service at the Illinois Eye and Ear at UI Health. Welcome, Dr. Chan.
Thanks, Jeff. Good to be here.
Today's topic is children's vision and eye health, and we're gonna cover a wide range of that. I know you have a specialty in pediatric retinal disease, which I'd like to explore, but let's discuss some of the more common vision issues in children first. I think most people have heard of the term lazy eye. Can you tell us about that, and more importantly, why it's so important that it get detected and treated early in young children?
Yeah, great question. I think this is something that we as ophthalmologists, talk to parents a lot about, especially for those of us who care for children. Now, for what it's worth, I'm a pediatric retina surgeon. I work very closely with my pediatric ophthalmology partners, and very often parents will come in and they'll be concerned about lazy eye, and and they'll have questions about what it is. And generally speaking, when we think about lazy eye, we think about something called amblyopia. And a lot of times, this can be confused for something like strabismus, right? Or an eye that turns. And I think that what we have to keep in mind is that amblyopia and strabismus are two very distinct things, but they can be associated with each other. And I think for me, in the pediatric retinal world, we very often worry about amblyopia. And what is amblyopia? And amblyopia is what is commonly known as lazy eye. Okay, and what happens? And what happens is basically from birth up to a very critical period. During this time, if one eye is seen better than the other, and this is typically how I explain it to parents, and the other eye is not seen as well, if you don't address that early, very often the eye that's not seen as well can not develop in terms of the vision. And that's really because it's being deprived or quote unquote lazy. So it's very important to identify these things early, to see an eye care provider, an ophthalmologist, or someone who cares for children. And then they can do certain things to strengthen the eye that's weaker and to make sure that visual development occurs to its maximum potential, right? So they can, for example, patch the eye that sees better, right? So if my left eye, for example, is quote unquote lazy, they can patch this eye to force that weaker eye to see better and really promote stimulation. So there are a lot of things that are important during that time. Very important also is, how a lot of times parents will say, well, how soon can I do this, or at what point is it too late? And again, there's a critical period. Usually people think around 7, but people have shown that between the ages of 9 to 12, sometimes there can be recovery of vision.
Thank you so much. And one thing that I think often we, and myself included, misunderstand is not necessarily every lazy eye is noticeable. It's not always crossed. Sometimes you can't notice it, and that's why it's so important to have your child's eye screened or an exam, because early detection for this is so important.
Yeah.
So one other thing that we've been hearing a lot about lately, especially as we come out of the COVID era, is the rise of myopia cases in children. Can you explain what myopia is and tell us how it can be treated and why we should be concerned about that increase?
Sure. Myopia is not uncommon. I wear contact lenses. I can see that you're myopic. And myopia really is just a function of, when usually it's when the eye is longer, or there's some change in the cornea where light and the image focuses in front of the retina. Okay, so the retina is the back of the eye. And basically what it means is that you can see things close up, and this is without glasses, right, or without a correction, but you have a harder time seeing things at distance. And we talk about this myopia epidemic and more people developing myopia worldwide. And we all know that this is an issue because one of the most common causes of visual impairment is just uncorrected refractive error. And it's something that can be dealt with very easily with glasses or just addressing it very early on. And I think, I have two small children. I think about their vision all the time. I think that when I was a child, I didn't get glasses until later when I had a vision screening at school. And for my parents are both ophthalmologists. So, for me, getting that exam early on, I think is really important, and identifying changes from myopia is important. Okay, so how do you correct it? Okay, glasses and just seeing the ophthalmologist or eye care provider. And one of the things we talk about is, well, how can we prevent it from getting worse? And we know that if you promote outdoor play and get kids outside, that's going to be really, really important for their development and for also preventing progression in myopia. And then there are other things that people have talked about, like drops or other maneuvers to see if they can prevent progression. But I think the most important thing is getting your child in early, making sure that they're seeing an eye care provider, and addressing those needs early on so that they can maximize their vision at school, when they play, for sports, for all the activities that they do.
Great, thank you so much. Another children's vision issue that we've certainly been hearing a lot about at Prevent Blindness is CVI, or cerebral vision impairment, or sometimes I think it's cortical vision impairment. Can you tell us what that is and how it impacts eyesight?
Yeah, this is also another condition that I think is really, really important to identify early, and to make sure that children are provided with the correct resources and the appropriate resources to maximize their potential. And what this is basically, it's not a function necessarily of the eye itself. It's a it's a neurological condition, right? For whatever reason, and it can be multifactorial, but it impacts vision, and it impacts a child's ability to see appropriately and to function through life. So very importantly, again, identifying these things early, and this is going to be something that parents will work with their pediatrician with, and with other providers who are in that healthcare journey for the child. And ultimately, what it comes down to is making sure the child is seen by really a multi-specialty group of people to take care of all their needs. But again, I think it's important to understand that this is more of a neurological issue as opposed to a function of the eye itself.
Got it. Got it. So it seems that many young people start to experience changes in their vision in their early teens. As you said, I'm myopic, and I'm one of those. I think it was 13 or so where I first got glasses. Why is that a time when we see increase in vision changes requiring correction?
Yeah, it's like everything else, but as we as we get older, and get with my children, I think about, okay, what's going to happen as they hit those teenage years, and a lot of things change. And in the teenage years, we're growing, right? Our body's changing, there are hormonal changes. So I think that all of this combined is affecting the anatomy of our eye, the vision, and it's one of those things where, as we go through life, it's going to be important to maintain appointments and the care for our vision health.
Yeah, it's a good kind of jump start to a lifetime of vision care,
Yeah.
when you first start experiencing those. So now let's turn to your area of focus, the retina. A condition that's unique to babies is ROP, or retinopathy of prematurity. What is that, and how is it detected?
Yeah. So ROP, and again, this is where where my passion is. It affects the youngest and lightest babies. All right. So children who are born premature are at risk for this. Generally speaking, when when we start screening exams, or who do we screen, that's one of the big questions. There are very set guidelines around this, right? There are very specific rules that we follow all around the world, right? And it's going to be very regional specific. In the US, we screen generally every baby who's less than or equal to 30 weeks of age, and then less than or equal to 1,500 grams. Okay, so these are the children that we screen. And then, of course, any child that the neonatologist feels that we should screen for whatever reason. Maybe they've had a challenging course, or they've had infections, or they've had significant oxygen exposure. These are children that we screen. It's better to be screened than not to be screened. And if you screen a child and there's no significant change, that's good. What you don't want to do is miss an exam, and then all of a sudden there are changes that may require treatment or lead to blindness. Okay, so if your child is born premature, very important to ask these questions about, should my child be screened for this condition, which is retinopathy or prematurity. Now, having said that, once your child is within our service and is getting eye care and screened, generally in the NICU, okay, in the NICU at first is when the first exam is. Every exam determines when the next exam is. So the findings from the initial exam will determine whether or not your child is seen in a week or 2 weeks and so forth. And what do we look for? Okay, so in ROP, what happens, it's like everything else when you're born premature, things are not fully developed, right? So in the eye itself, the retina is not completely developed, and specifically in terms of the retinal vasculature, or the retinal blood vessels, are not fully developed. So, the way I describe it to parents is, if you have a growth of the blood vessels, and these are the blood vessels, and they're growing, and they can just stop. Okay. And when they stop, you can develop this area, which we call ischemia. And ischemia is where there's no retinal vasculature, retinal blood vessels. That can stimulate the formation of these growth factors and other things that can then promote the formation of new vessels. Okay, and these new vessels can also develop pulling on the retina and so forth and so on. And you can see changes in the retinal blood vessels that we would call something called plus disease. Okay, so what are the things we look for? We look for zones, we look for stages, and we look for the presence or absence of something called plus disease. The way I describe it to families mostly is, zones is our geography, right? It's how much is the normal blood vessel development. And you can have zone 1, 2, and 3, and the lower the zone, the more severe the disease. And then you can have stage 1, 2, 3, 4, and 5. And 4 and 5 are divided into subcategories. We won't necessarily go into that. But the higher the stage, the more severe the disease. Okay. So generally speaking, mild disease is a higher zone in a lower stage. Okay. But there are certain things that we look for, specific categories of disease that we will either see your child more frequently or may indicate treatment. And generally speaking, we mentioned this thing called plus disease. If you have this plus disease, then your child will need treatment. Okay, so very important, that your child is screened early. Very important that they have these exams. And if you're discharged and you go home, very important that you make the follow-up exams so that the ophthalmologist can provide the care that is needed for your child.
Thank you for that. I know this is really a very alarming and often devastating condition, and which is why there's a lot of research in this area. Can you talk a little bit about some of what's going on the research front as it relates to ROP?
Yeah, so I think over the years, really over the past 20 years, there's been a lot of movement and a lot of advances in the way we treat children. Historically, you go back to the 1980s when they started looking at whether or not treatment mattered or not. And when you think about people who've been blind from this disease, you think about Stevie Wonder, for example. And that was back in the 1950s and 60s, where they didn't have good treatments for this. Okay. Now we have lasers for treatment, right? We have now injections of medicine for treatment. We've now just had the first FDA approved, at least in the United States, medication in aflibercept or Eylea for this condition if you need treatment. But there are also some other drugs that have been used, specifically bevacizumab or Avastin. So you hear about all these things. So there's a lot of research in terms of therapies. There's a lot of research also in terms of diagnostics, right? And how do we screen better, better protocols? Me specifically, I do work in artificial intelligence and telemedicine with a group with Pete Campbell and some others, and Mike Chang, who developed that group. So there's a lot of people in this space looking at how to make care better for children, but also risk factors and so forth. What's nice now for parents is that if we catch it early, we can save your child's vision. And then as we go forward, what we're potentially trying to do is limit the number of exams that are required for these screenings, and also provide better treatment modalities. So a lot in this space. I think it's an exciting time for all of us, but most importantly, we can prevent children from going blind.
Yeah, that's terrific. And yeah, really, I mean, it's just an innovative time right now in retina research in general, and certainly in this area as well. Another alarming condition often detected in childhood at some point is retinitis pigmentosa, or RP. Can you talk a little bit about this and discuss how it's addressed once detected?
Yeah, so retinitis pigmentosa, again, it's a condition that generally, we will see in children, but also you can manifest changes later in life. And there's a lot of heterogeneity in this condition, right? So it's not different from ROP, which I think is a little bit more predictable to a certain extent. RP, I think, can affect people very differently, and it can be associated with other systemic conditions and so forth. But generally speaking, what we want to look for are patients who have complaints of night blindness or tunnel vision, decreased vision, color vision abnormalities. So if you have a family history of retinitis pigmentosa, I think it's very important to have children screened early, right, and seen by an ophthalmologist. And then if there are any issues, plugged into the services that they need, right? So should they see low vision specialists? Should they see people who can help them with just life in general, occupational therapists? Genetic testing and counseling, I think, is very important. And I think that there are a number of people who are expert in this space around the country, and this is a burgeoning field of research. So looking at gene therapy and so forth, I think there's a lot of opportunity in that space. And a lot of organizations are investing heavily in new discoveries and try to make new therapies, but also promote better living for these children. Okay, I think that's very important. So a lot of research, clinical trials, support groups, other mechanisms for making sure that your children are managed appropriately. So I think that if there is a history of RP in your family, get checked early. Make sure your children are cared for, because I think you're going to have better outcomes in the long run.
Yeah, this is an area we've been doing a lot of work at Prevent Blindness and around mental wellness and vision. And this is certainly an area where I think that's so important, when detected, to also take care of your mental health and not only the patients. I've talked with a number of parents who, when this condition is detected, don't really know how to handle it. And I think it's important for them as caretakers to take care of their own self as they're trying to support their child through this diagnosis and care. So let's talk a little bit about just general eye care overall. Is it possible to conduct an eye examination on very young children? And how can parents prepare their children for an eye exam?
No, absolutely. And again, as I mentioned earlier, this is something I've really stressed with my kids, me and my wife. I think it's very important to have your vision screenings early. So generally speaking, within a year of birth, I think it's important, specifically probably around 6 months or so, you should have your child, seen by a pediatric ophthalmologist, and then subsequently, based on what the recommendations are by by the physician. So it is very important, right? And I think that it's one of these things where, there's a lot of unknown about, okay, well, if I get my child screened early or check their vision, there's what do we do next, right? And what's the outcome? But again, it's for all these things that we just talked about, amblyopia, RP, right, CVI. A lot of times you're not going to be able to pick those things up just through daily living, right? So just getting seen early, having that reassurance that everything's developing appropriately, I think is really important. It's important to also make sure you're seeing somebody who's friendly to children, right? There's pediatric ophthalmologists have great ways to make your child comfortable and make sure that they're having a good experience in this in this care space. At home, what can you do? I wear glasses, and for I'll show my daughter and my son, well, okay, here's what you do, and we kind of make it a game, you talk about it, right? You talk about, this is what's going to happen, everything's going to be okay. You come home. I mean, we can play this game of, okay, what's the reward of after you get your eye exam, but it's a very routine thing, right? And I don't think, I think that if you seek the right physician, the right provider, you're in good hands. But at the end of the day, having that reassurance, having an understanding of what your child's eye health is critically important for the long-term success in general.
Yeah. We often, you just shared that so many conditions aren't recognizable and aren't noticeable, but we also know that some are. For parents and caregivers, what are things they should look out for in their young children that may indicate an eye problem?
Yeah, and I think a number of things, right? So I think that you're always looking at what your child's normal behavior is. Are they holding things very close up front? Do they squint a lot, right? Are they rubbing their eyes? Things like that. And I think also one of the things you look for is the eye turn, right? One of the things that comes up quite frequently, especially with very small children or children who are just born, they're not going to fixate completely, right? So there may be a little bit of movement that's not completely aligned, but as they get older, what you really want to look for is an eye turn that stays, right? And or something that's more, of any concern. My recommendation to most parents is better to bring your child in and get checked, and it can end up being nothing, than to neglect it, right? Or not bring them into the doctor. Other things that we worry about too are things like retinoblastoma or Coats disease, right? So taking a photograph and looking at the reflex in the eye is something that you want to look for, because those things, if caught early, can, one, save a child's life, but also save a child's vision and the eye. So eye turning, looking too close, anything that's unusual, I would say seek an ophthalmologist, seek a pediatric eye care provider, and get checked early.
Yeah, and certainly you're aware as a member of the board of Prevent Blindness that one of our focuses is really about access. And unfortunately, not every family has the same level of access to eye care or to healthcare in general. So I think that's another reason why it's so important to have public health programs that stress the importance of vision screening, early eye exam, and education, as well as just encouraging parents to take them. Sometimes it's a little more complicated than just take your child to the eye doctor when they're trying to figure out how to do that and where to do that. So, Dr. Chan, if a family has one child with a vision issue, should they have the vision of their other younger children examined as well?
I would say yes. And, again, this is the world that I live in, right? So we oftentimes see young children who have siblings who have the same issues. So I think, again, like we mentioned earlier, it's better to get checked than not get checked. And a lot of things that we look for, things will be fine. But in some cases, there can be some genetic predisposition. Certain conditions can run in families. So I think it's important to get checked early.
Yeah, thank you for that. Well, thanks so much for your time today. Before we sign off here, do you have any other final thoughts you'd like to share on children's vision and eye health?
So Jeff, first off, I want to say thank you to you and Prevent Blindness for having this discussion. I think it's critically important for families to understand the importance of eye health in their children. And very importantly, as we mentioned over and over again in this conversation, better to get checked, better to make sure that things are going well. And if there are any issues, having those issues addressed early. So again, this is a team effort on every level. And I think for the parents, getting your children examined and cared for is the most important thing.
Yeah. Well, thank you so much again. And for anyone looking for more information on children's vision and eye health, please visit the Prevent Blindness website at preventblindness.org or the website at the National Center for Children's Vision and Eye Health, which you can also find on the Prevent Blindness site. Thanks again, Dr. Chan.
Thank you, Jeff.